Good afternoon, everyone. My name is John Klepper, CEO and co-founder of Pipra. I realize that lunch is just around the corner, so I'll try to keep this on time. So the title of my talk is a little edgy. Are hospitals dementia factories? And can AI transform the way we age, preventing dementia and delirium in tomorrow's hospitals? I want to start off by stating very clearly that hospitals and healthcare professionals are in the business of improving and saving lives. And personally, I'm extremely grateful for the incredible hard work they do, often underappreciated, in order, when in our time of need and most need. So, having said that, there is still a tremendous lack of awareness around a lot of the complications that arise from hospital stay. And like most large organizations, there could be room for improvement. So show of hands, who here has actually heard of delirium? Not talking about the beer, the neurocognitive disorder. Okay, so maybe 10% of the room, 15%. That's good. It's not enough. For those of you who don't know, delirium is a neuropsychiatric disorder that often presents as disorientation, hallucinations, memory loss. It is described by many patients as the most terrifying experience of their life. And I want to just mention a paper that was published in 2022 in Nature, written by Tamara Fong and Sharon Anouilh, and it's called The Interrelationship Between Delirium and Dementia, the Importance of Delirium Prevention. And in it, it states, delirium prevention strategies have been shown to reduce not only the incidence of delirium, but also the incidence of adverse outcomes associated with delirium, such as falls and functional decline. So we all know that falls and functional decline can greatly impair how we age. So why aren't we talking about delirium? Is this a small issue, or is this a large global issue? First of all, there's a lot of different types of delirium. There's ICU delirium, medical delirium, alcohol withdrawal delirium, prevalent delirium. I want to start by talking about post-operative delirium. And why? Because it's the most common post-surgical complication by far. It affects nearly 1 in every 4 patients over the age of 60 and has serious long-term consequences. 600% increased risk of nursing home admissions. 38% of patients continue with long-term cognitive complications, typically dementia. And for those patients who get delirium, their risk of getting dementia goes up 14 times. 25% of patients will die within 1 month. The picture you see here is of my mother. A few years ago, she had a routine surgery and woke up a very different person. For several days in hospital, she thought the staff were trying to kill her. She saw monsters coming out of the walls. Terrified, suffering from post-operative delirium. Luckily, my mother made a full recovery, but she has PTSD from the experience and refuses to go near a hospital, which is not a good outcome. And to give you some perspective, it's 60% more expensive to healthcare than diabetes, making this one of the biggest problems in healthcare that's completely unaddressed. 60 million people per year suffer, more likely 120 to 150 million, because 50 to 70% of cases are missed. They're not diagnosed. And for hospitals, it's an average cost of over 11 million euros per hospital per year, mainly because patients stay much longer in hospital and they need much more care. So the good news is it's preventable. The problem is these preventive measures, while they're relatively simple to do and highly effective, they do take extra time. And that's something that healthcare professionals just don't have. So what happens today? Reactive care, when it's too late and basically you can sedate the patient, versus preventive care, which is highly effective. So how do we address this problem? At Pipra, which is the company I work for, we created a machine learning algorithm to help predict which patients are at high risk, to help clinicians identify those high risk patients. We stratify the risk into different risk groups. We write that back into the electronic health record, and we allow for targeted prevention on those high-risk patients. That reduces stress, workload, length of stay, adverse outcomes like PTSD, falls, infections, readmission rates, improves bed availability, I think that's supposed to say availability, and it reduces costs. And on the cost side, one of our clients just is about to publish a paper that they wrote talking about the 25 million euros that we can save just one hospital using Pipra. So what did we learn? We learned that deploying a risk prediction model in a hospital was not enough. Nothing happened. Telling them which patients were at risk did nothing. We needed to go further, so we built this bundle, which is in the middle, which helps support the prevention and the monitoring of compliance of things like early risk assessment, prevention, diagnosis, making sure that compliance is high, and if there's a certain ward that maybe isn't complying, that we can look at that and that administration or the heads of wards or departments can see why is that particular ward not working. Is there a lack of awareness? Is there a lack of enthusiasm about it? Or is there a technical problem? And then fix that. And then we also added e-learning, which helps especially junior nurses who may not be familiar with delirium, what to look for, how to prevent, how to treat. And some of the results, so this is from one hospital in Switzerland with about 300 beds, 29% reduction in delirium incidence, nearly a full day reduction in length of stay, and 4 times reduction in nursing hours. And just to go into just a little bit briefly about the interrelationship between delirium and dementia. So keep this brief, but in the setting of precipitating factors such as hypoxia, metabolic abnormalities, medications, infections, surgery, for example, and in the presence of vulnerability such as Alzheimer's disease or cerebrovascular disease, a patient will often experience delirium. However, in the presence of resilience, such as where you have cognitive reserve, for example, or preventive strategies like Pipra, which I mentioned pre-surgically, those patients are much less likely to get delirium. The development of delirium and subsequent neuroinflammation is likely to result in the acceleration of underlying neurodegenerative pathology leading to dementia. And dementia is expected to double by 2050. If we look at countries most impacted, Spain is right at the top. Currently, around 21, 22 million people affected, expected to more than double to 41% by 2050. And despite decades of research in delirium, the incidence has not changed in 40 years. Why? Because it's a complex problem. It needs the combination of interdisciplinary alignment, the use of technology like Pipra, but most importantly, the willingness from hospitals to actually change standard of care from reactive to preventive care. So if there are healthcare professionals in the audience, and I've spoken to a couple already, which is great, please come see me afterwards if you'd like to learn more. I'd love to tell you more about it. Similarly, if there are any investors, we are currently raising, so I would love to talk to you as well about that. Finally, our mission at Pipra is to ensure that people like my mother and our loved ones leave the hospital better than when they arrived, not worse. Thank you so much.